We will now define several terms that are important for community health assessment. The first term is population. Population is a group of individuals that share one or more characteristics. It is in fact a construct. One constructs populations based on the characteristics that one chooses in order to make a population. So for example, we can have a population that is the people who reside in the same geographic area, for example, in a given county or state or even a country. It could be the people of a similar age, all those persons, for example, older than 65 years of age. It could be people of the same ethnicity or country of birth, so all people who were born in Russia, for example. It could be people who use a particular hospital. So it might be a hospital setting within a given state, or even a hospital that serves members from several states. Or it could be all people with a particular disease, such as AIDS. Here's just a graphical representation of how one can put together different populations. We have some geographic areas here represented by the tan, yellow, and green colors, representing countries, states, and towns. So it can be the persons that are within each of those bounded areas. You could also have personal characteristics that constitute a population. For example, on the right-hand side of this figure, the persons who happen to have a red color. That might represent a particular individual characteristic from which one can constitute a population. Next, we define community. The Institute of Medicine in 1997 published a report called Improving Health in the Community, a role for performance monitoring, which will be one of the main texts that is used in this course. And in that publication, they defined community as individuals with shared affinity and perhaps a shared geography who organize around an issue with collective discussion, decision-making, and action. They added a comment related to this particular definition, namely that geography emerged as a critical point of reference in the committee's discussions. Although geographic or civic boundaries cannot adequately capture all of the potentially meaningful communities to which individuals might belong, they are a practical basis for analysis within the limitations of current data systems. Depending on the health issue, the relevant geographic unit, for example, county, city, census tract, may vary. So, the bottom line is that the IOM, although saying that there can be different things that organize communities, the most frequent way that this is done currently is by using a geographic definition. For example, a neighborhood, the geography of a town, a county, a state, or a country. Those are some examples of geographic definitions of communities. The next definition is that of health. In 1948, the World Health Organization adopted a definition of health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. In 1997, in its report, the Institute of Medicine defined health as a state of well-being and the capability to function in the face of changing circumstances. Obviously, this is a slightly different definition than the WHO definition, although it shares some similar characteristics. The IOM went on to say further that health is, therefore, a positive concept emphasizing social and personal resources as well as physical capabilities. Improving health is a shared responsibility of healthcare providers, public health officials, and a variety of other actors in the community who can contribute to the well-being of individuals and populations. The next slide shows a conceptual framework for the patterns of determinants of health, in other words, things that impact, influence, or cause health. And this is taken from a well-known article by Evans and Stoddard known as Producing Health, Consuming Healthcare from 1990. And it shows various factors that influence health. Social environment, physical environment, and genetic endowment are on the top. These in turn impact individual responses, both behavioral responses and the biology of an individual. These responses lead to and affect health and functioning of the person. They can also bring about diseases that affect the health and function of a person. And then these all in turn affect the well-being and prosperity of an individual. And then over in the middle and the right we have healthcare, which is one of the other components which can be brought to bear on individuals to try to deal with improving their health. The next definition is that of assessment. And again, the IOM committee came up with a definition, and they found that the core functions of public health agencies at all levels of government are assessment, policy development, and assurance. This was actually from the 1988 Institute of Medicine report on the future of public health. And in further elaborating on assessment, the Institute of Medicine recommended that every public health agency regularly and systematically collect, assemble, analyze, and make available information on the health of the community, including statistics on health status, community health needs, and epidemiologic and other studies of health problems. Not every agency is large enough to conduct these activities directly, so intergovernmental and interagency cooperation is essential. Nevertheless, each agency bears the responsibility for seeing that the assessment function is fulfilled. This basic function of public health cannot be delegated. We have now defined separately community, health, and assessment. And next we will look at 4 different definitions of community health assessment. In other words, what we get when we put the 3 things together. And the first that we're going to look at is the definition presented again in that 1997 Institute of Medicine report. And here it is. Community health assessment should be part of an ongoing, broader community health improvement process. A community health improvement process uses community health assessment data to identify priority issues, develop and implement strategies for action, and establish accountability to ensure measurable health improvement, which are often outlined in the form of a community health improvement plan. The community health improvement process looks outside of the performance of an individual organization serving a specific segment of a community to the way in which the activities of many organizations contribute to community health improvement. So there are several important aspects of this definition. Community health assessment itself is part of a larger process. The community health assessment generates data and information that helps to identify priority issues, leading to development and implementation of strategies. And the community health improvement process, as well as community health assessments, need to engage multiple segments of a community because the findings from a community health assessment will relate to the entire community and its particular strengths and weaknesses related to health. The next definition is one that was developed by the North Carolina Department of Health and Human Services and is taken from their Community Assessment Guidebook. They viewed community health assessment as a process by which community members gain an understanding of the health concerns and healthcare systems of the community by identifying, collecting, analyzing, and disseminating information on community assets, strengths, resources, and needs. Community health assessment usually culminates in a report or a presentation that includes information about the health of the community as it is today and about the community's capacity to improve the lives of residents. A community health assessment can provide the basis for discussion and action. So the North Carolina definition focuses more specifically on community health assessment itself, but it also talks about the process of gathering data and information about the community. There's often the production of a report that itself can then lead to further action based on the community health assessment. The next definition comes to us from the National Association of County and City Health Officials, or NACCHO, in their definition of an ideal community health assessment. And they viewed a community health assessment as a process that uses quantitative and qualitative methods to systematically collect and analyze data to understand health within a specific community. An ideal assessment includes information on risk factors, quality of life, mortality, morbidity, community assets, forces of change, social determinants of health, and health inequity, and information on how well the public health system provides essential services. Community health assessment data inform community decision-making, the prioritization of health problems, and the development, implementation, and evaluation of community health improvement plans. So this definition actually is similar to the North Carolina definition, but it goes into greater detail on the particular kinds of information that a community health assessment generates, uses, and it, like the North Carolina and IOM definitions, talks about community health assessment as informing a subsequent process on community decision making and community health improvement planning. Finally, we have the definition of the community health assessment that comes from the Public Health Accreditation Board's set of definitions, version 1.0. So they define community health assessment as a systematic examination of the health status indicators for a given population that is used to identify key problems and assets in a community. The ultimate goal of a community health assessment is to develop strategies to address the community's health needs and identified issues. A variety of tools and processes may be used to conduct a community health assessment. The essential ingredients are community engagement and collaborative participation. Again, similar, this definition has similarities to the other three that we have looked at. This particular definition emphasizes towards its end that a variety of tools and processes can be used to conduct a community health assessment, and it also emphasizes the importance of community engagement and collaborative participation.